Thanks, Sean. And thanks everybody for joining today. I'm Kieran Prior. I actually joined BHF at the end of last year, and I'm the head of clinical research programs. And I'm joined by my colleague Sarah, who's a senior research advisor looking after our clinical fellowships. So I think we'll just use the time today just to give a bit of an overview of BHF and kind of our remit and scope. Focus on the kind of research schemes, particularly applicable to clinical research, and then I'll hand over to Sarah, who'll go into a bit more detail about the clinical fellowships and the ins and outs of those schemes. And I think there'll be time for questions at the end as well. So just a very brief bit of history about a BHF. We've been around for a long time. We were founded in the early 60s, and really the purpose is to raise money for research into heart and circulation diseases, treatment and prevention, with a focus on improving patient care. Obviously that's 60 odd years. My maths isn't great. Working out how we can show impact, and I think since then a lot has been achieved. And there's kind of two key graphs to really show, and the first here is just showing the rate of death from coronary heart disease in the UK, and that's fallen from 79% since 1975. And the bottom graph there is the rate of death from stroke in the UK, fallen by 83%. So obviously BHF are proud to say played a key role in kind of developing and delivering extraordinary innovation across many areas, including these in cardiovascular medicine. But I think one thing to note is that our work isn't done here, and you can see those graphs, they're starting to plateau, and so it's really important for us to continue the drive to increase innovation in cardiovascular medicine across the UK. So we are the largest funder of cardiovascular research in the UK, and we support over 440 million pounds worth of awards across over 50 institutions, fund around 1,200 research staff across the UK, and support across the kind of research pathway, and we're funding around 46 trials, worth just under 40 million pounds. Also driving a focus on kind of innovation and translation, with sort of 69 patents filed in the last 5 years, and also working towards spin-outs as well. And we've got 9 spin-out companies currently active. So that's a real drive for us to kind of ensure that is that ongoing patient impact into what we're trying to deliver. And just a quick snapshot as well, from looking at our research funding portfolio from last year. So we invested just over 100 million pounds across 28 research institutions across the UK. And BHF does have a broad remit across that cardiovascular disease space. So you can see there in that bar chart the real range of kind of areas of disease that we cover, including stroke and dementia, as well as more sort of um, traditional heart disease as well. I'll just pause there. So I'm not sure if people can see the slides. I think it sounds like someone's got issues viewing the slides. Sarah, can you see the slides okay?
Yeah, it's fine for me.
Has anyone else got issues seeing the slides? Not sure what's going on there. I think what we can do is we'll make sure we send the slides around after today, if that's okay with Sean, and then we'll definitely be able to refer back to the content on the slides if there was a particular element that was missed. So we also been obviously working towards our new research strategy. In May last year, we launched our new strategy, and that's based on 3 key principles. So really focusing on diversifying the science base, and I'll talk a bit more about what we mean by that as well. How we can partner on specific challenge, so we know we can't achieve all we want to achieve alone. So partnering with relevant organisations is a really key element for us to actually deliver impact. And we really want to make sure we're leveraging additional skills, technology, and funding, and making sure that we're broadening out who we reach to, who we engage with, and who's delivering in cardiovascular disease, so that we can really achieve change. And ultimately, we really want to be bolder and more ambitious to unleash the power of science and technology and make the most of the advances in technology at the moment, to deliver impact for patients living with cardiovascular disease. So just digging into the new research strategy in a bit more detail. A couple of key points we just wanted to pull out. A key focus for us really is on addressing the gap between the sort of scientific discovery research that BHF funds and its translation to patient benefit, and that's something that we really feel our clinician scientists and others are in a really key place to drive that forward. And we have a drive more broadly to grow our translational and clinical research portfolio as much as we can. And that's why kind of meetings like this are so important to us to really try and get out there and emphasize that point to as many as we can. Um, the key element I mentioned previously about being kind of bold and ambitious is something we really want to drive forward. So we're really encouraging the community to think big, deliver ambitious and high impact research to enable patient benefit. And we've evolved our funding schemes to accommodate that. So as we'll talk through, we've raised or removed some of our funding caps, so really enable our community to deliver and answer the questions that are going to have that patient benefit. And we really want to see those ambitious applications come through to our funding committees. As I alluded to before as well, we really want to focus on partnership, and we really do believe that progress can really only be achieved through partnerships between different disciplines, including what we might think of as the traditional BHF community. So we're looking to engage beyond that and bring more people into kind of cardiovascular disease research. So diversifying the science base is really critical to us in order to sort of capitalizing on the revolution in science and technology. So we want to make sure those working, in biomaterials, for example, in data science and AI, are thinking about how they can apply that technology or into the cardiovascular space. So that's like a bit of a kind of whistle-stop tour of BHF, I guess. I think we just wanted to kind of highlight the kind of key funding schemes across BHF that are relevant to clinical research. These are kind of sort of more project and program specific awards, and then I'll hand over to Sarah to talk through the fellowships in more detail as well. So, as I've said, our strategy really outlines the ambition to significantly grow investment in clinical and translational research. And we think a key way of doing that is going to be through high quality, ambitious clinical studies that truly lead to patient benefit. So there's a number of kind of different ways that I guess clinical research can get funded through BHF. So I'm going to try and sort of summarize these here, and then obviously we can signpost people to further information as required, as needed, either at the end of this or if people want to follow up by email. So we have our clinical study grants, and I apologize in advance. There's a lot of text on this slide, but just wanted to try and get everything onto one piece of on one slide. So our clinical study grant, these are grants that are normally for larger clinical trials, usually late phase, but often can be large observational studies of specific patient groups. These are, often over £500,000, normally over 3 years in duration. We don't have a formal cap, but obviously we will be, reviewing for value for money. These studies can include mechanistic evaluations, whether that's seen as a sub-study or as part of an observational study. But generally, these grants support the clinical trials and hypothesis-based observational studies. On this sort of smaller scale, we have our project grants. So this is often where we encourage our early career researchers to apply to as well for those smaller clinical research projects. So these are for studies lasting up to 3 years. We've just adapted that, so where where applicants can justify 4 years as needed, we will allow that, and costing less than £500,000. So again, that's a recent increase in the cap that we had for our project grants. So generally, PIs will be sort of postdoctoral researchers at any stage of their career, but applications from early career researchers, are really welcome, and we can include the salary for lead applicants who require it for our project grants awards. Then just to flag, we've also got our program awards. So these are, larger, longer term, generally 5-year awards. Also can be renewable funding, and these are for programs of work to address significant research challenges. And this can include a variety of different activities, but all focusing towards one strategic research theme. And in many cases, this can include clinical studies and translational research as well. Then we also have our translational awards. So these very much are focused on the aim to sort of progress novel, innovative technologies towards benefit for human cardiovascular health. So these are quite broad in sort of remit. Projects can start and finish at any point along the translational pathway. So that can include preclinical studies and early phase clinical trials, Generally, these are up to 3 years, with clearly defined progression milestones developed. And a really key part of these awards is the kind of commercialization piece as well. So proposals are expected to demonstrate strong intellectual property position, and development propositions that really could attract follow-on investment. And we can, as a BHF, can kind of work with applicants and grant holders to support that activity as well. And then lastly, just to mention as well, is our sort of special project grants. So these are quite similar to our program awards, on the kind of sometimes of scale, but maybe where they're more specific, potentially looking at studies using data sets only, perhaps population and patient-based cohort studies, or in some cases experimental medicine studies as well. So these are for those kind of large scale studies that perhaps are larger than our traditional project grants that we get through our project grants committee. So just wanted to kind of flag some sort of elements that what good looks like when it comes to BHF clinical research. So clearly we need to have the research addressing unmet need. Studies really should be clinically meaningful and filling any evidence gaps that are well articulated in the application. Feasibility definitely is key. Studies need to have a credible plan for delivery, recruitment, and study management. Collaboration is really important as well. So we really want to understand and for applicants to really articulate why this group is the right group to answer this particular question at this moment in time, bringing together the right expertise and resources to answer those questions. Making sure the relevant statistical input has been kind of incorporated in the application. So, that depends on the type of study being put together. But for example, we'd expect to see a definitive interventional trial designed with 90% power, and we'd like to see the obvious expertise involved in the application to enable the delivery of that as well. Then looking at patient and public involvement, this is really key for our clinical research, obviously. So we want to see sort of meaningful and relevant PPI demonstrated when it comes to kind of developing the research question and when it comes to thinking about study design and delivery as well. And of course, being appropriately costed as well, so making sure that applications have that justified funding request. Obviously, as I've said a lot of times, we want to see boldness and ambition really is key, but obviously kind of value for money is going to be scrutinised by our funding committees as the application comes through. So just to sort of clarify as well, so Sarah was going to talk through our fellowship schemes in a bit more detail, but we do support discovery and clinical scientists at every stage of their careers, from kind of PhDs to research professorships. And as I said, we have a workforce of over 1,200 people, supporting around 450 principal investigators, and supporting people is really key part of what we do as BHF. And the last thing I think I just wanted to say is just as well as our traditional funding schemes, we do fund kind of critical research infrastructure across the landscape. We're kind of co-funders in our Future Health, the UK Biobank, also the BHF Data Science Centre, and we really want to make sure that the applicants think about how they can engage with those initiatives when putting applications together and to make the most out of those investments. And particularly to flag two kind of clinical research focused initiatives as well. So we've got the NIHR BHF cardiovascular partnership, where it's focused on driving cardiovascular translational research, and the BHF clinical research collaborative as well. So they're focused on supporting the planning and delivery of clinical research in cardiovascular disease, really bringing together research groups to kind of identify and prioritize key research questions in particular areas. So really do encourage you to think about how you can engage with those kind of initiatives as you put applications together coming to BHF. So I'll pause there and I'll hand over to Sarah to run through the clinical fellowships in a bit more detail. Thanks, Sarah.
Yep. Hi, everyone. So as Kieran said earlier, I'm the Senior Research Advisor for Clinical Fellowships at BHF, and I'm going to talk through our offering and how that's changed recently. Next slide, Kieran. Brilliant. So as you may be aware, we made a lot of changes to our fellowships, so that's discovery and clinical fellowships over the past year. And we've launched new clinical fellowships offering in October last year as part of our refreshed research strategy, acknowledging that we need to grow the strength, breadth and diversity of the UK's clinical academic cardiovascular workforce. So a lot of the work and the changes that we've made have been informed by our Chief Scientific and Medical Officer, Brian Williams, and his participation in the OSCAR task forces, which you may have heard of. So these task forces have produced some reports acknowledging the decline in clinical academic career pathways and proposing recommendations around this. So a lot of that's been taken into account with our fellowships. The QR code on your screen there will link through to the blog written by our team, which outlines a lot of the key changes to our postdoctoral fellowships and some of the increases in support funds, if you want to reference that in your own time. Okay, next slide, please. Okay, so the graphic here outlines the entirety of our clinical fellowships offering. So you can see that we span the career stages from PhD training through to senior fellowships. And just to highlight that a lot of the changes that we have made have been to our postdoctoral schemes for clinicians, so the boxes in red, including the introduction of a new clinical early career research fellowship, addressing a gap that we previously haven't had a funding scheme for. So we also offer funding for healthcare professionals, so that's allied healthcare professionals, nurses. We fund pharmacists, perfusionists, echocardiographers, a load of different people through these schemes. So we offer PhD funding and postdoctoral funding there. We also offer the Consultant Research Award for substantive NHS consultants, and we have a partnership with the Academy of Medical Sciences, which has just been renewed for another 4 years, which funds clinical starter grants. So we fund up to 6 of these per year that fall within BHF's remit. So the QR code on this slide will scan through to what we fund. That will give you the list of all of the funding schemes, including those that Kieran mentioned, and has all of the details of the specific schemes. And then just to also highlight on the slide that the arrows across the top, so transition to research, early independence, transition to independence. So we've mapped our schemes to the new National Clinical Research Careers Framework, which is a new clinical framework for clinicians that was published last year and which is accessible on the Clinical Academic Careers Hub, which I can point you through to towards the end of this presentation. And also one of the things that we get asked a lot, and which is maybe not that obvious, is that we don't have an expectation that you have to have funding from BHF at all of the different career stages. So you can come in and out of BHF funding at whatever stage of the pathway applies to you. So it's not a requirement that you have to have PhD training from us to move through to postdoctoral fellowships or anything like that. Okay, next slide, please. Okay, so first I wanted to just briefly touch on PhD training. So we have 3 different PhD funding schemes depending on your career path. So we offer an intercalated MB PhD funding for those who want medical students who want to do a PhD during their medical studies. We have the Research Training Fellowship, which is for our allied healthcare professionals. So this one is slightly different to the other 2 in that it can either be held full-time with time permitted for clinical duties, or it can be held part-time alongside clinical role. So it depends what works best for you in terms of this scheme. And then we also had the Clinical Research Training Fellowships, which is PhD training for medics who are between foundation training and before CCT. So we don't offer post-CCT PhD funding at the moment. So typically the CRTF is held during that program period. So for all of our PhD funding, we offer 2 application calls per year with deadlines in July and January. We fund 3 years duration, but with the RTF that can be split part-time, or for caring responsibilities, we also offer part-time fellowships. And the key difference with these schemes and our postdoctoral schemes is that it's the primary supervisor who applies as the lead applicant for our PhD funding, with the named candidate as part of the application. So an award will support either the applicant's salary or, in the case of the MB PhD, a student stipend. It will fund tuition fees, research consumables, and a travel fund. So things like research skills training can be included within the research consumables. And I've said typically up to £18,000 per year in terms of costs. That's a guidance, it's not a fixed limit. We do get people who, or applications that come in above this where it's justified, but you should be aware that anything above sort of the 18,000 per year mark is probably going to be subject to more scrutiny at committee. Okay, next slide, please. So as I mentioned in the overview slide, we've launched a new clinical early career research fellowship. So it's a new scheme. It's designed to provide protected postdoctoral research time for resident doctors alongside their clinical training. So it's the first sort of independent award to enable transition from PhD through to building early postdoctoral research experience. And we acknowledge that not everyone necessarily needs funding in this gap, but it is a gap that we've identified in our portfolio that will hopefully address some of the issues with people being able to be competitive enough for mid-career fellowships later. So the idea is that this scheme works a little bit like a clinical lectureship. So it'll be held part-time alongside specialty clinical training for a maximum duration of up to 4 years. And ideally it'll be coterminous with CCT. So we're emphasising flexibility, so it's up to the candidate to decide duration and time commitment. And the idea is that it allows candidates to develop their research and their clinical skills at the same time. So all of our fellowships are open to all clinical specialties, not just cardiologists, as long as the project's in BHF's cardiovascular remit. So we're really enthusiastic about the scheme. We've had one round so far after the launch in October, and we really encourage people to publicise this scheme amongst your networks so that everyone can see what it offers. So in terms of what it supports, it'll support the applicant's salary for the research time, salary for a support post if it's needed. You don't have to include a support post, but it is there. It will support research consumables and equipment, training and development costs, a travel fund, and a small contribution to aid with caring responsibilities that arise as part of, your fellowship. So, for example, if you need to work late in the lab in an evening, you might need to pay a babysitter to look after any dependents. It's that type of thing. We recognise it's not a huge contribution, but it's part of what we're trying to do to address some of the barriers to research in our portfolio. So next slide, please, Kieran. So our new Clinical Future Leaders Fellowship replaces our former Intermediate Clinical Fellowship. So this provides long-term postdoctoral research support to talented clinician researchers as they transition to independence. So this is for candidates who have either finished their clinical training and become consultants or who are towards the end of clinical training. So the expectation is that someone applying for this award will have some postdoctoral experience already. And it is a very competitive scheme. So in terms of the major change from the previous intermediate fellowship, we're now offering 7 years duration of funding. That's upfront. With a progress review around years 4 to 5. The proposal itself should span the full 7 years, but we do acknowledge that that might be detailed experimental plans for the first 5 years with a more high-level overview of aims expected for years 6 and 7. One of the major changes or things that we've introduced to this fellowship is that the host university must commit to providing a permanent post to the fellow at the end of the award. And this is to enable long-term career security, and it aligns with the similar future leader offerings from UKRI, MRC, CRUK. So in terms of when that commitment needs to be provided, at the point of of application, you will need to provide a letter of support where the host institution will outline their support for you. But the actual commitment to the tenured post is not required to the progress report. And it's expected that the actual post will commence at the end of this 7-year award. So the salary does include time for clinical duties, so you can enable fellows to maintain their skills and competencies. And as I just noted, it aligns with the recommendations from the Oscar task force, which calls for longer support, aligned funding schemes, and defined career pathways. So you can see on the right-hand side what the award supports. So it is 100% salary, so we're not tapering like some of the other funders. We are providing salary for an associated research post, research and equipment costs, a discretionary fund, which can basically be used for anything related to your fellowship, but particularly training and development costs. There's a travel fund and the caring responsibilities fund again. So all of the deadlines for our clinical schemes are the same. So the upcoming deadlines are the 1st of July and the 13th of January 2027. Next slide, please, Kieran. So we also have the Clinical Senior Research Fellowship, which supports outstanding clinician scientists who are looking to grow their research group and are on a leadership trajectory. So these are generally quite senior candidates who have already developed or already established their group and need a little bit more funding before they launch into securing high level program research grants and or professorship grants. So candidates will have achieved this CCT and we're offering 5 years duration with no extensions any longer on this award, and we're requiring the host institutions to support 50% of the applicant's salary, recognising that these are very senior people who have been on the academic pathway for quite some time at this point, and we're really wanting to encourage host institution investment here. So the offering is very similar to the other awards, with the exception that it's 50% salary only, and we will allow salary for 2 associated posts. So that's can be either a postdoctoral research assistant, technician, research assistant, whatever you need on the award. Okay, next slide, please, Kieran. So we also have the Consultant Research Award. This is for substantive NHS consultants, and it's to enable protected research time in addition to clinical role. So applicants must have a PhD or MD-Res already and should be substantive NHS consultants. So not someone who's already on an clinical academic contract. So the award typically backfills clinical PAs in a 10 PA job plan, but if you're someone that already has a 12 PA job plan, we will consider this as well. So you must, as part of the application, provide a before and after job plan, which shows how your research and how your clinical time would be structured over an award. So it has to be a proposal that's a distinct research question or program of research. So it's not to be used just as sort of gaining pilot data for a future large-scale applications. It has to have a distinct research question itself. And candidates do need to explain how an award will benefit their career progression and how it will enable them to continue to conduct research, but it's not necessary that it needs to be a stepping stone to an academic fellowship trajectory. For some people, for some applicants it is, but for others they're pretty happy staying within the NHS as a consultant, and we're comfortable that that's a good thing, that we want to support people who are undertaking research within the NHS. So you can see the offering there. I'm going to skip through to the next slide just so we can make sure we cover everything. So we also have the Career Development Award for our allied health professionals, and this is a postdoctoral award which enables research time alongside clinical roles. So With this scheme, we typically say that the research is usually related to your clinical role and is typically focused on improvement of care and outcomes. So we don't see much discovery science through the scheme, and we would say that if you're a healthcare professional looking at the scheme and you're thinking about discovery science, to get in touch with us first, and we'll be able to offer some advice. So the scheme itself is 3 years duration with the possibility of applying for a 2-year extension. Can be held either full-time with time for clinical duties or part-time, if that works for you. And a second award can be held after the first award if a compelling case can be made for how this would enable the candidate to transition to independence. So this award will support salary for the lead, salary for a support post, research consumables, and the travel costs discretionary fund and caring costs contribution on all our other schemes. Next slide, please. So in terms of, I was just going to cover some sort of general application guidance from what we see come through our funding committees. So fellowships focus on the project, the person and the place. So there's a few things that need to be in place for a really good application. So in terms of person, some of these obviously are dependent on your career stage in the scheme that you're applying for, but it is crucial to highlight why you're the person to lead the project and to outline the development and training opportunities, particularly in the early career awards as well. Personalised support letters within your application are hugely important, as is showing how you're going to move towards independence and to develop your own research niche. In terms of evidence of impactful research outputs, this is not necessarily just high impact papers. This is anything that demonstrates research impact that you've had. In terms of project, one of the most important things is that our committees often comment on is that the proposal needs to target novelty within the cardiovascular science. And that can be clinical research or discovery science. So in terms of clinical fellowships, the offering is for clinicians and healthcare professionals, but the science can be clinical or discovery science. Ideally, a fellowship will be a mix of new ideas and techniques, but building upon previous work and experience that you have. A clear plan should be included with timelines. We now require a Gantt chart in the case for support with all our fellowship applications. Pilot data to support hypotheses is always really important. We're often asked how much pilot data is needed. It really depends on your project and the type of award that you're applying for. For a substantial award like a Future Leaders Fellowship, we might expect enough pilot data to demonstrate that you can undertake the proposal that you're planning on doing. But for something like an early career fellowship, you might not have a lot of pilot data, and that's fine as long as you can demonstrate that you're the person to lead and that you can execute this project. In terms of the next thing on the list is around the aims and how you structure your fellowship. So interdependent aims is one of the biggest sort of pitfalls in fellowships that the committee always pick up on. So for example, if work package 2 and 3 are reliant on what happens with work package 1, that can be a bit of a pitfall that the committee doesn't like, because it's then not clear if work package 1 fails, what will happen with work package 2 and 3. So one way around that is to include risk mitigations. That's something the committee really likes. And the third sort of key important thing is place. So the research environment that you choose should have the expertise, facilities and resources that you need. It should offer opportunity for collaboration and development. And there should be some sort of commitment from the institution towards you and your development. That's not always money, although obviously you would see with the senior fellowship, it does require the contribution to salary. And then with the future leader, we are requiring a permanent post at the end. So that's institutional commitment. But also personalised letters of support, training offers, specific training courses that an institution can fund for you. That type of thing is all acceptable. What we are sometimes see is offers of funding PhD students as part of an award and things like that. So we advise that you have a conversation with your host institution, your head of department, as soon as possible about what you may be able to include in an application. Next slide, please. Right, so in terms of the people that you include in an application, so we have changed our terminology with the new fellowships offering. So rather than supervisors, we are now referring to the people that will help you as academic advisors. So on our postdoctoral fellowships, you will need to have a primary academic advisor. So this is the person that's within the host institution and will guarantee the access to space and resources for you. They should be an expert in a closely related field and be able to provide academic guidance as well. If you have a secondary institution in your application, so for example, you want to go and spend 3 months somewhere else learning a technique, you should also have a secondary academic advisor from that institution. You can choose to just have a secondary based at your home institution if they provide alternative expertise. So that's also fine. We really strongly encourage you to include mentors or to get mentors and to include them in your application. These people should be independent from your supervisors, your academic advisors, and should be able to provide impartial career advice and support for you. You can name up to 2 in your application. And obviously collaborators can provide scientific advice, samples if you need them, access to technologies and methodologies. So you don't need to have collaborators, but they can be a useful way of demonstrating independence in terms of forming new networks and provide an extra support system for you as well. Next slide, please. Okay, so just to cover a few pitfalls that we often see come up in applications. So committees will comment if a proposal is unfocused and over or under ambitious. So you have to be able to show a clear project plan and a timeline that you can deliver on. You need to be able to show why your work needs to be funded. So highlight the novelty and the impact of the work. And one of the biggest mistakes that does come up quite often in fellowships is don't ignore prior work in the field. Committee members will pick up on this very fast. So lack of pilot data. So pilot data isn't the be-all and end-all of everything, but it's useful to show that your hypothesis has a foundation and that you can conduct the research. So sometimes in a fellowship, it'll be a mix of something you've done before or based on something you've done before using skills you've done before, which you might have pilot data for, which is great. But it is okay to include absolute new stuff that you don't have pilot data for. I think it'd be a very high risk approach to include just new stuff in a fellowship without pilot data. In terms of sort of new areas, if the area is completely new to you, include collaborators for support. This is a useful way around that. And I mentioned interdependency in the aims before, but including risk mitigations. So for example, what will happen if something in work package 1 doesn't work out as expected? What alternative approach might you take? And then the last one on the list is choosing the right place to do the research. So obviously it needs to provide excellence and support, but we often asked whether you need to move institutions to demonstrate this, particularly after PhD, between PhD and postdoc. So no, you don't need to move institutions, but you must demonstrate intellectual independence. This is particularly important when you're sort of moving forward into the more intermediate mid-career fellowships. So if you've done your PhD with the same supervisor, you've done a postdoc fellowship, you've done an intermediate fellowship, and then you want to move into a senior fellowship with the same people involved, it's not likely to be favourably viewed. But that's not to say that you have to move on from your supervisors. You just need to demonstrate what the intellectual independence is. This can be done by the letter of support from your advisor that actually says, okay, I'm giving up this part of the work, I'm letting the candidate take on this part of the work. So that type of stuff can be beneficial with that. So I think we're moving on to the final slide now, which is just to talk a little bit briefly about the process. So the fellowships committee, the clinical fellowships committee, you can see the membership if you scan the QR code. It's all updated on our website at the moment. So we've split our committees, a fellowships committee recently. So we have a clinical fellowships committee where all these applications that I've talked about today will be assessed. So currently at BHF, each application is considered individually on its own merit. So when you submit an application, it's considered in its own right. You're not in competition with others. We don't produce a ranked list or anything like that to decide applications at the moment. So we assign committee members to lead on the discussion of each application. So you'll have 2 members will lead on the discussion, and the committee reaches a collective decision based on the discussion in the committee meeting. We also have, we approach external subject matter experts for written reviews, and that informs this discussion. So you can suggest names of people that you think would be appropriate to review your application. It doesn't mean we'll always use them, and please don't suggest people who you work with and have published with, because we don't approach people who have conflicts with you either. In terms of your application, obviously we have both those subject matter experts and committee members. So the committee members will not necessarily always be subject matter specialists in your field. So make sure your application is written in a way that's accessible to everyone. In terms of feedback, so feedback of the committee discussion and the written review comments will always be provided to you. Fundable candidates to the postdoctoral scheme, so anything that's not the PhD training schemes, will normally be interviewed. That's usually by the 2 committee members who have reviewed your application and either 1 or 2 of the expert reviewers who also reviewed your application. And you'll receive that feedback ahead of an interview if you're going to be interviewed. So that's kind of a whistle-stop tour through fellowships. If you go on to the last slide, Kieran, I think, yeah. So we've got our general contact details. So if you have general questions that's not necessarily about fellowships and eligibility and advice, then you can reach out to our research email. In terms of pre-application fellowships advice, we are always happy to answer queries around this. For our sort of postdoctoral fellowships, we do encourage people to get in touch with us if you have any questions about your eligibility, suitability. We'll often set up Teams calls to chat through these types of things with potential candidates. So please get in touch for this via our fellowships email address. And then obviously myself and my colleague Barbara, who primarily work on clinical fellowships, but we work within the wider fellowships team as well. And then just to point out the QR code at the bottom, which is the reference to the CATCH Clinical Academic Careers and Training Hub. If you've not already seen this, it's a really useful resource which BHF contribute to, which spans clinical academic funding opportunities, training opportunities, careers advice and things like that. It also has the reference for the National Clinical Careers Track pathway, which I mentioned earlier. So it's a really useful resource for anything to do with clinical academia. And that's it from me. So I guess some time for questions now.
Yeah, thanks, Sarah. Thanks everybody for listening. Yeah, I think the take home message is definitely get in touch with us if you're considering application, and would be keen to chat that through with you and guide you in terms through the application process. But yeah, happy to take questions now.